Hey everyone, it's Miss Giovanna again. We are going to be doing lesson 8 today, and it's called HIV/AIDS epidemic. Per usual, we're going to start with the video and then we'll have a little chat afterwards.
So, what'd you do this weekend, Sarah?
OMG, you guys. I met such a hot guy at a party.
Who?
His name is Justin, and he's in college.
I think I know that guy.
He's so hot.
Oh, I remember.
We made out for hours.
Really? I've heard Dustin has AIDS.
What?
Girl, you made out with him? If you swapped spit, you could be infected.
Wait, what? Are you serious? No. No, this can't be happening.
Okay, so just a quick summary of some of the points made in the first half of the video. So there is a misunderstanding or lack of knowledge in the topic of HIV, right? So they're talking about how the girl right here on the screen, she made out with the guy, and because you make out with somebody and if they have HIV, then you automatically get it as well, right? So that is a lack of knowledge, and that is a stereotype or stigma that comes with if somebody has HIV, which it is wrong, because if somebody were to kiss somebody else, like in the video here, they were making out and one person has HIV, saliva is not one way you can get HIV. So we'll see what happens in the second half of the video. But for the first half, right, she's a little worried now because she doesn't have the accurate information and she's not sure what to do. Okay, so what are today's learning objectives? Identify the magnitude of the AIDS epidemic, identify the fluids and body routes for HIV transmission, identify effectiveness of ART and PrEP in the prevention or treatment of an HIV infection, express concern for persons with disabilities or illnesses. Okay. And today's evidence of achievement, you participated in lesson activities, you completed your lesson worksheets, you made a commitment to avoid behaviors that spread HIV. And again, like with the other lessons, your evidence of achievement will be completing all the worksheets and activities that are under your Google Classrooms for lesson 8. So, what do you all know about the AIDS epidemic? If you don't know a lot, hopefully we'll give you a little bit of information here. So it is worldwide, right? There's no specific part of the world, a specific community in the world, a specific community in the United States that is primarily affected. AIDS is an epidemic that affects the entire world. And like I mentioned, it can affect men, women, and children. And if you're a little confused as to why children, I'll explain a little bit further on. But again, it affects everyone, or can affect everyone. There is no cure. So the thing with HIV and AIDS is that there is no cure, there is no vaccine to prevent somebody from getting this virus. So that's why we try to advocate for people to know about HIV and AIDS so that they're well educated. Like I mentioned, it is a virus, and it is not spread by casual contact. So for example, if somebody who has HIV gives you a kiss on the cheek, if they hold your hand, if they give you a hug, if they drive your car, things like that, casual day-to-day contact is not how you are going to get HIV. So I'm kind of throwing the letters out here, HIV a lot, but what do they stand for, right? So the H stands for human, which is a disease in human beings, not in other animals. So a lot of the times people think like, can mosquitoes, for example, transmit HIV? And no mosquitoes, no dogs, nothing like that. It's only a human disease. Immunodeficiency basically means it weakens the body system that is supposed to fight diseases. So it weakens your immune system. Virus, a very small living particle seen only through a microscope, which can cause serious infections. So HIV stands for human immunodeficiency virus. Now we're going to also be talking about AIDS, which is a little different from HIV. So let's go over what those letters stand for. So it stands for acquired, the A stands for acquired. So from some place or someone else, not from within yourself. Basically meaning you have to get it from somebody else. You are not going to just one day wake up and you have HIV, you have AIDS. It doesn't work like that. You have to get it from somebody else. Immune, so able to fight off infections. And then deficiency, not enough of something, unable to fight infections. So basically means that a person usually starts with HIV first. And because HIV, remember, it's attacking your immune system, it attacks it until you get to a point where you have a very weak immune system, so that your immune system is unable to fight off any other infections. When you get to that point where your immune system cannot fight off any more infections, they categorize that as AIDS. So the first stage is, if you will, it's HIV. And if somebody doesn't get tested and treatment in time to stop the spread of HIV in their body, then it can further damage their immune system to where it's very weak and it's now AIDS. Okay, and then I know I just mentioned some medication for HIV and we'll go into that a little bit more. But just want you all to keep in mind, first, it starts as HIV, and if somebody is not treated or tested in time to get that medication, their immune system can be weakened enough to where it's now AIDS. And syndrome, a combination of signs and symptoms that represent a particular disease. So basically means that when somebody has AIDS, they can have different symptoms. So symptoms can be like they feel like they have the flu, or they're lightheaded. So different signs and symptoms. What happened? Oh, I skipped a few things. Sorry about that. Okay, here we go. Okay, so what are the numbers? So statistics in the US. So more than 1.1 million people in the US are living with HIV today, and 1 in 7 of them does not know it. So the thing with HIV is that HIV, like any other STD or STI, the most common symptom is no symptom. So if you feel perfectly fine, the odds are you won't, go as often to the doctor maybe to check. So a lot of the times people can go a good amount of time without getting tested, without going to the doctor, because they feel perfectly healthy. And during that time when they're, feeling perfectly healthy, if they don't know they have it and they're having, for example, sexual intercourse or having sex with somebody, they could be transmitting it without knowing. And we'll go over the fluids that transmit HIV as well. An estimated 39,600 Americans became newly infected with HIV in 2015. Young people ages 13 to 24 are strongly affected by HIV, accounting for approximately 1 in every 5 new HIV infections in the US. So this can be for a couple different reasons, right? It can be, your sexual health isn't talked about much with young people. It's not something, you kind of everyday conversation. Maybe young people are not going to get condoms, are not educated on the topic of HIV, are not using protection. So there's a bunch of different reasons why this can be as well. So just to give you all a website here, if you're interested on seeing what the rates are of HIV, AIDS, and STIs in your state, you can go to this website here on the screen. And I believe it also breaks it down by county and by city as well. So something, kind of fun if you're curious to see, what the cases are in your area, you can go ahead and visit that website too. So how is HIV transmitted? So I talked about how we are going to learn about the body fluids and the body openings in which HIV can be transmitted. So let's start with the fluids. So there are 5 fluids, okay? So you have blood, breast milk, semen, vaginal fluids, and rectal fluids. So, and well, that's the body fluids. And for body openings, it can be through the mouth, openings in the skin, for example, if you have a cut, genitals, so the vagina or the penis, and anus, okay? So when we're talking about blood, behaviors that can transmit blood that can put you at risk for HIV can be, for example, if you get a tattoo, if you get a piercing, if you're using steroids, things like that. And the reason I mention that is because if you're going somewhere to get a tattoo and they're not using brand new needles and they're reusing needles that they've used on somebody else, for example, if somebody previously that used a needle had HIV and now they're reusing that needle on you, HIV can be transmitted that way. So that's why it's very important if you're going to get a piercing, a tattoo, and things like that, that wherever you go, that they're using a brand new needle, because even if they try to sterilize it, they could still there could still be traces of HIV on there. So blood is one of the fluids. Breast milk. This is where I mentioned earlier that children are also affected by HIV, because if a mother is HIV positive, she could have HIV in her breast milk. So the children can be affected because if the mom, say, doesn't know that they have HIV, then they can give it to their baby unknowingly. Also, if a mother's HIV positive, they can't have a regular vaginal birth. They have to have a C-section, because if they're born through the vagina, like a regular normal birth, then they're exposed to the vaginal fluids, right? And again, as you see here, it's one of the fluids that does transmit or can transmit HIV. And just so that we are clear, because we've had in previous classes confusion, when I say that mothers have had a C-section, it doesn't mean that every mother who's ever had a C-section is because they were HIV positive. That is not the case. The reason I say C-section, let me backtrack. So that's not the case, okay? If your mom or somebody you know had a C-section, that doesn't automatically equal that they have HIV. Sometimes it can be pregnancy complications, or it's better for the mother or the baby to be born through C-section. So it can be things like that. So just so we're clear on that. And if you don't know what a C-section is, it's basically they cut open the mom's abdomen to be able to pull the baby out that way versus being born through the vaginal canal. Again, just so we're clear on that. I know this is a lot of information, so please, if you have questions, we have a section in your reflections for the lesson where you can ask questions. I know it's a lot of information I'm giving you. But moving on to semen. So semen is the fluid that males have, right? Or people with penises have. So it is another fluid that can transmit HIV, just like vaginal fluids, especially if you're not using condoms or a barrier method when you're engaging in sex. You can be putting yourself at risk that way too. The last one is rectal fluids. And rectal fluids is something that we all have, because if we didn't have rectal fluids or fluids, around our anus, then going to the restroom would be very painful. So rectal fluids, nothing out of the ordinary, everybody has them. But the reason it's up here is because if you're engaging in anal sex, for example, and you have rectal fluids and you're not using protection, you can transmit HIV that way as well, okay? So again, body openings go hand in hand with the body fluids, okay? Okay, so what is the role of the immune system? I mentioned it a little bit earlier, but let's go over it real quick. The immune system is a defense system that protects against disease by detecting and destroying a wide variety of pathogens. Okay, what happens when HIV infects the body? So the first thing is first, HIV enters the body. HIV takes over the immune system to produce more HIV. So what was supposed to be fighting off the infection, your immune system, is now being hijacked by HIV cells to produce more HIV. Your T cells become HIV factories. So your T cells are part of your immune system, which helps fight off infections. But like I said, they are now hijacked, so they just start producing more HIV. HIV antibodies appear in 3 to 12 weeks. Basically means in those 3 to 12 weeks is when, if somebody were to go get tested, their tests would come out positive if they were HIV positive. So what are treatments for HIV and AIDS? So again, keep in mind, there is no cure for HIV or AIDS, but there are effective treatments to control the illness. HIV is a type of virus called a retrovirus. Antiretroviral treatment, also known as ART, is treatment for HIV and AIDS. ART keeps an infected person healthy for many years by reducing their viral load and reduces transmission of HIV to their sex partners. So let me break that down a little bit. What the treatment does, ART, what it does is that it stops HIV from producing more HIV in your body. And that's how it reduces your viral load. When we talk about viral load, we're just talking about the amount of HIV in your body. So it reduces it so that it doesn't keep producing more and doesn't keep damaging your immune system. Okay. ART can also prevent someone from becoming infected with HIV after a possible exposure. This treatment is called post-exposure prophylaxis. So again, I know we're throwing big words out here, but post-exposure prophylaxis, easier to remember it as PEP, is treatment that somebody can take after the fact if they think they had been exposed to HIV. So ART is if somebody has already tested positive for HIV, it helps control the virus in their body. And then PEP is medication that somebody would take afterwards if they think they were exposed to HIV. But with PEP, I believe you have only up to 3 days to take it, and that's when it is more effective. So let's talk about PrEP. So I went over ART, I went over PEP, and now we are going to go over PrEP. So PrEP stands for pre-exposure prophylaxis. And this is something you would take beforehand. So it's a way for at-risk people, sexually active people, or people who inject drugs to avoid becoming infected with HIV. When taken consistently, PrEP has been shown to reduce risk of HIV infection by more than 90%. PrEP users must commit to taking the drug every day and seeing a healthcare provider to follow up every 3 months. So let me give you an example of somebody who might be using PrEP. So say there are 2 partners, right? And one is HIV positive and one is not. But say they're trying to have a child, for example. In order to be able to to conceive that child, the person who is HIV positive would have to be taking the ART medication, and the person who is HIV negative would have to be taking PrEP. And this is to prevent them from getting the HIV virus. And as you can see, it is 90% effective. And that's how somebody, if they wanted to conceive a child and one is HIV positive, one is HIV negative, that's how they could go about doing that. So you have ART. I'm just going to go over it again with y'all. You have ART for somebody who is HIV positive to control the virus. You have PEP, which is medication after the fact if somebody thinks they were exposed to HIV. And then you have PrEP, which is before engaging in, sex, for example, to prevent getting HIV. So we're going to be watching the video and kind of have a little chat afterwards.
I can't believe I might have HIV from making out.
HIV is spread through saliva. Actually, that's not true. Don't worry, Sarah.
What?
HIV is only spread through blood, semen, vaginal fluids, rectal fluids, and breast milk. Oh, but what if he had a cut in his mouth or something?
Right. Should I still get tested?
That's probably a good idea, just to make sure you're okay. If what I heard about Dustin is true. And especially if you've done anything more with Dustin besides making out.
Okay, I've got to talk with Dustin about this. I mean, he should tell me himself if he's HIV positive.
That's right. And Sarah, remember to always use a condom. And what did the teacher say? Avoid risky behavior.
We'll say, I know that. Esther, I'm so glad you remembered all those details. And okay, I'm going to get tested as soon as I can. Thank you, ladies.
Come on, let's go to class.
Okay, so the second half of the video, we see that Sarah is the one who is making out with Dustin, and who initially in the beginning, right, thought that, oh no, like, you know, I made out with him and now I have HIV, because Dulce, the one in the blue shirt, was the one who, you know, was under the impression that that's how HIV was transmitted, right? So in the beginning, they were both a little misinformed, but then we see here in the second half, Esther, the one with the love shirt, the orange shirt, she kind of throws some knowledge at them, right? She told them the fluids that do transmit HIV, the fact that saliva does not transmit HIV, and then both Dulce and Esther gave Sarah some good advice, right? About, you know, getting tested and about if she is going to be sexually active with Dustin, using protection as well, right? Again, barrier methods is a good way to prevent from getting HIV. But then Sarah also brought up a good point, which was talking to your partners, right? If you are sexually active, you are getting tested. If you ever come out positive for an STI, which includes HIV or AIDS, it's important to have those conversations with your partner, okay? Making sure that if you're sexually active, you are talking to your partner of whether they're getting tested and making sure you're getting tested yourself so that you're both being responsible and protecting each other's health. Okay, so we kind of went over how the story ended here. And we are going to go into our quiz. So the quiz actually, like in other lessons, it's in your Google Classrooms along with a few other worksheets. You can write down the answers and then fill it out or come back whenever you would like. So the first statement is, the AIDS epidemic impacts men, women, and teens. And this is true, right? Remember I mentioned that the AIDS epidemic has no preference, has no boundaries. If you are engaging in risky behaviors, you are putting yourself at risk. The human immunodeficiency virus, or HIV, prevents the body from being able to fight off infections. And this is true. Remember, HIV hijacks your immune system so that your body no longer has something to fight off infections. Body fluids which can spread HIV include blood, semen, vaginal fluids, and urine. And this is false. So remember the 5 fluids that we mentioned, urine was not one of them. So that is why when you go to a clinic to get tested, if you're going to get tested for HIV, they don't do a urine test because they can't detect HIV through urine. The goal of antiretroviral therapy, or ART, is to extend the infected person's life by keeping his or her HIV viral load low. And that one's true, right? Again, ART is just to control the virus in somebody's body. Okay, so this question, along with this one, will be part of your reflections under your Google Classrooms. And if you want some food for thought, get the ball rolling again with the adult in your life or your parents. You can ask them this question: how old they were when they first heard about the AIDS epidemic and what they heard. dig their brain a little to see how much maybe they knew back then and how much they know now, or if they don't know anything, maybe you can educate them a little bit about what you've learned in this lesson. So we are done with lesson 8. Hopefully you all learned something new, and we'll talk to you next time. Bye.